Everyone, this is Britt.
This is Larissa.
Kristen.
And Nick, and this is our Leadership in Action project. We came up with an intervention to support for adverse childhood experiences.
The Minnesota Department of Health describes that as a traumatic experience in a person's life occurring before the age of 18 that a person may remember as an adult. And there are 3 types of ACEs, which are abuse, neglect, and household dysfunction. So a higher exposure to these ACEs before one turns 18 is thought to be a risk of development and negative issues in adulthood. And we found also that ACEs are a universal experience and global issue through our research.
So the definition of our issue is, what effect do adverse childhood experiences have on mental health outcomes in the context of college students and or in young adults, with a specific emphasis on University of Minnesota Twin City college students. The image on the right shows how multiple factors come together in causing ACEs and the areas of life in which they affect, ultimately focusing on college in the yellow circle.
We're planning to engage in the community of University of Minnesota students, specifically within first-year incoming students. There's a specific concern with college students and the impacts that mental health has on them. A study that was conducted at the University of Minnesota found that ACEs predicted worsening of mental health over the course of a semester and suggested the current number of stressors as a mediator of the relationship between ACEs and mental health. The study found that it was particularly useful to identify those who are high risk for deterioration in mental health, and that stress-related interventions would be beneficial for students with high ACE levels.
The 2 leadership frameworks we chose were OII and Bright Spots. These frameworks represent stepping back to see the whole picture, seeing what works and what doesn't, and what can be changed is naturally occurring in these 2 frameworks. The process of these frameworks allows us to think critically about the why and how. Our number 1 focus through this was the students and what they would experience, making these frameworks more applicable to the issue than orchestrating conflict and thinking politically.
For the leadership framework of observe, interpret, and intervene, we were able to specifically use our multiple strategies pitch to use this framework. In our multiple strategies pitch, we were able to talk to our peers about the survey, their comfort level with it, free will versus forcing them to use it. We interpreted from the pitch of multiple strategies that students liked the idea of having an option to take the survey more than other strategies. Our further interpretation from this is that students are more comfortable and therefore more likely to participate if they are given the choice to take the survey rather than being forced to take it.
For Bright Spots, we discovered many things that were exciting and working well within ACEs. For example, Trauma Recovery Center in the UK provides support options and education around ACEs that is optional for people to use. In addition, we saw a lot of data gathered through surveys because people were willing to take them. It was these positive aspects we saw working in research and companies. When choosing our strategy, we were unsure of what to do. However, Bright Spots were beneficial because they gave us a foothold. By looking at what was working well in these areas and translating that to our own project, it inspired us to combine all strategies into one.
Little overview of the proposed engagement strategy. We are going to be offering an ACEs indicator survey to any incoming first-year students. This would be administered by the University of Minnesota through Boynton Mental Health, Student Counseling Services, and the Aurora Center. The survey is a form of a checklist that asks a series of questions regarding childhood trauma and its effect, and this would be similar to a patient health questionnaire, which gives the participant a score, an ACE score, and then based on the score and the type of trauma experienced, different follow-up responses will be noted on student record for appropriate service. And the students would then have the option to use support resources. They can either opt in or opt out of them. And these can include general resources about ACEs, contact information of places to reach out to, or the support of university members.
The research that informed our proposed engagement strategy really stems from a University of Minnesota study, which is called The Effects of Adverse Childhood Experiences, Stress, and Social Support on the Health of College Students. In that particular study, it was found that there's a need to increase awareness of the association between ACEs and health on college campuses, to examine the effects of ACEs in more detail, and to design ACE-informed programs for this population. Additionally, our 2 non-governmental organizations that we researched, the Trauma Recovery Center and the Tubman Center, provide a lot of healing-based support to survivors of ACEs. So essentially, we reached our engagement strategy by utilizing the U of M study about increasing awareness through the survey, and then looking at the work of NGOs to decide to provide healing resources for student ACE survivors.
So for this strategy, we would think that it would need to be proposed by a student advocacy group or leadership team. and that would need to be proposed to the Minnesota Student Association or Board of Regents. Buy-in would really need to be necessary from the University of Minnesota because they would likely have to put in money and resources, especially the services from Boynton Health, Aurora Center, and the student counseling services. For the stakeholders that are impacted, that would be the University of Minnesota, but it would also be the students who are benefiting from the screening and support.
Over the course of this project, we studied 2 additional global perspectives, the United Kingdom and India. In the United Kingdom, we really researched the Trauma Recovery Center, which we mentioned earlier in this presentation. And we also found that researchers in the United Kingdom stated that an ACE indicator index could help inform the allocation of resources for services, which helped inform our strategy. And then a study in India found that over 90% of Indian children experienced ACEs, and that those ACEs required serious prevention efforts and post-experience support. Overall, from our global perspectives, we were able to gauge that there is a need for preventative and post-experience support.
At the U of M, there is currently no program that exists to screen and survey students who have dealt with ACEs in their past. This survey and screening would identify what and how many ACEs the students at the University of Minnesota have experienced. And once the type and amount of ACEs are identified, we would then be able to identify what type of intervention, counseling, physical treatment, et cetera, would be necessary.
The strategy is realistic because it fits well with society. It's common for people to be screened for mental health, and a study by Karatikin found that surveys are realistic to find better ways to support students because they're brief and simple. Also, our strategy provides the option to receive support, which is more reasonable than being pushed into receiving support. Having options gives space for people to be involved, spread awareness, and do things at their own pace.
Our strategy will take time, and we will look for success in the long term. Success for our strategy is threefold in that rapid decrease in the number of mental health issues, that student participation in these surveys would be around 90%, and students report that they feel educated on ACEs. It may take 2+ years before we see any decline in mental health issues, but participation and knowledge in these surveys is something that we can see success with immediately.
So with our survey, we want to make sure that we're being appropriate with different cultures and cultural considerations. There are different cultures that we need to be aware of and respect, which could be living situations or country of origin, race, or gender. We also want to consider different cultural aspects that might put a student at more risk if they engage in this survey.
For our strategy, there are a lot of stakeholders involved. We would need the Boynton Health Clinic, the Aurora Center, and student counseling services. Hopefully, they would be willing to help and provide financial support. Healthcare providers, therapists, psychologists, they would need to be adequately prepared to handle a lot of patients. Students, obviously, their participation is necessary for our success. And university officials, the reputation of college and success of the program is at stake.
So in summary, these ACEs are traumatic events that people can experience in childhood, which leads to mental health issues in their young adult years. And addressing these impacts of trauma early on in life can lessen the severity of these effects. So by creating a program like this, it'll allow the University of Minnesota to recognize students who may be at that higher risk of developing these mental health issues. And the university could potentially minimize these negative effects by intervening early and providing adequate support for high-risk students. This sort of program will also reinforce to future students support and healing is possible throughout your college years.
That concludes our presentation. Thank you very much for watching. And if you do have any questions, please ask any one of us. We would be more than happy to answer them.